Hi, I'm Dr. Travis Stork. I'm really pleased your employer has chosen MD Live as a new benefit for you and your family. MD Live is a totally new healthcare service that connects you to a doctor by phone or secure video at your convenience 24 hours a day, 7 days a week. Trying to see a doctor these days can be a real hassle, particularly if you have to wait for a long period of time in a crowded, germ-filled doctor's office or emergency room. Or what if you're not feeling well when traveling for business or on vacation, it's late at night, and you discover you forgot your prescription? What are you going to do? Well, as an MD Live member, you can connect to a doctor immediately, even if it's after hours or over the weekend or a holiday. And when appropriate, MD Live physicians will send a prescription instantly to your local pharmacy. For many health issues, MD Live can help patients avoid the inconvenience, but also the high cost of going to the emergency room. MD Live services are provided at a fraction of the cost of an ER visit. Our physicians are U.S. board certified emergency room and primary care doctors, as well as pediatricians with an average of 15 years of experience. And what's particularly exciting is the high level of customer satisfaction that members are experiencing. Here are some testimonials from MD Live members who have recently used the service.
The most beneficial thing about MD Live to me is the time that it saves me, because during a school year I'm a teacher and I have 100 kids that are mine. And I have no time between my own children and the children that I deal with at school to go sit in a doctor's office. And so being able to call someone and know that they'll help me out when I need them the most is very important to me.
I really believe that MD Live is going to help the whole healthcare system work better, because it will take minor things that can be treated over the phone or online and open up appointments at the doctor's office for the things that are a little more serious.
When your life is centered around your family like mine is, your schedule can get pretty hectic. And when you or one of your family members gets sick, like my son Jason did a while back when he developed a painful earache, finding time to set up an appointment with a doctor can be extremely difficult and time-consuming. Now that my family and I have joined MD Live, nights like these are far less stressful than they used to be. It was so easy. I was able to connect to a doctor without leaving the house. I logged into my son's account and followed the simple point-and-click instructions to schedule an appointment. I started by selecting pediatrician from the provider type menu and clicked search. From the list of pediatricians, I selected one that had the option to visit now and available by video. On the next screen, I entered earache as the reason for the appointment. And since I wanted to use online video to see the doctor instead of just talking by phone, I selected the video option for the secure consult. Shortly after the appointment was placed, I got a text and an email notification that the pediatrician was ready to see Jason and me. We connected to him through a video for consultation, where he asked detailed questions about his symptoms. The doctor asked whether he had a fever or had a cold or upper respiratory infection, and I said no. He also asked if Jason had been swimming recently and whether he had pain when I tugged on his earlobe. My answer here was yes.
Jennifer, from the good history you've given me and the reaction I see by Jason when you tugged on his earlobe, it's most likely that Jason has what's commonly known as swimmer's ear. The condition may develop when water, sand, dirt, or other debris gets into the ear canal. I'm going to prescribe antibiotic ear drops, which you can pick up at your local pharmacy. Even though he may feel better before the treatment is complete, please be sure to continue using the medicine as directed for a full 10 days. In the meantime, to help him feel better, you can place a warm cotton cloth against his ear to help relieve the pain. Until the ear infection is better, you should not go swimming. In the future, to prevent swimmer's ear, it's a good idea to dry his ears thoroughly with a clean towel after swimming, bathing, or showering. If his condition worsens or he does not improve, please consult with your child's pediatrician. Have I answered all your questions? Great. By the way, Jason, hang in there. You're going to be just fine.
My husband was able to pick up Jason's medication on his way home from work. With the help of MD Live, my son Jason was able to get the medication he needed quickly and without leaving the house, or without even leaving his bedroom. And my family didn't have to spend the night in an emergency room for symptoms that only needed a simple prescription. The next morning, my son was feeling much better and our family was ready for the new day.
I was so satisfied that I would be excited to use it again. I, would not hesitate to call if I had something wrong. I would actually probably call MD Live before I even attempted to call my doctor's office at this point. I used to take my daughters to urgent care for pink eye, and we would wait for hours and hours, and now I can call MD Live and get the care we need right away without the wait and without the worry. I would say for the first time I don't feel like just a cog in the wheel or just a number in the system, that I actually felt like I was helped and cared about.
When I get sick, the first thing that comes to my mind is call MD Live, because I want to feel better. Now with MD Live, I can call the doctor before I get to school. I can go pick up my medication during my lunchtime or after school. I don't have to miss work because MD Live provides services where you just give them a call. They will call you back, and it's the only device that you need is your phone.
Well, signing up for MD Live was really easy, a lot easier than I expected. So once I was all dialed in and I knew that I had the relief of knowing that if I got sick, I would be able to just connect real time with a doctor. I mean, that was huge for me. The doctor was really kind, knowledgeable, was able to answer my questions right away, definitely put my mind at ease, was able to diagnose my symptoms really quickly and get me the information that I needed right away. So that was great. Yeah, I would say knowing that I have MD Live is really relieving, as when I'm traveling especially, because I don't have to worry about finding the nearest hospital if I were to get sick, whether it's something serious or, something simple as a cold. So definitely I'm very relieved and feel a lot more comfortable and confident knowing that I have that in my back pocket if I do need to use it. So when I first heard about MD Live, I thought with this type of service, it must be outrageously expensive. And so when I looked into it and found out that actually connecting to a doctor online is cheaper than my copay to go to the emergency room, I was just thrilled. I couldn't believe it. Well, right now I feel like it's difficult enough to get in with my physician, and with the changes that are coming in healthcare, I think it's going to be tougher and tougher. So knowing that I have MD Live already set up, I'm able to connect with a physician online. I mean, that's great. It's really comforting. I feel like when I get sick, I'm almost taking a chance of getting more ill by going to see a physician, because there's a bunch of patients in there with all different kinds of symptoms. So by connecting through MD Live, I'm able to connect from my own home directly to a physician online, and I'm taking away that risk.
When I have gone in to see a doctor, I feel rushed. I feel it's a little bit impersonal. I just get treated quickly and I'm out. Not like that with MD Live. With MD Live, I have time to ask my questions. They're patient with me. They work with me. I have a much better experience with them. Now, knowing what I know, with MD Live, I would have saved a lot of visits, a lot of medical visits, doctor visits with my kids, myself, and had a better experience doing it with MD Live.
There's no reason why I should go sit in a waiting room for 3, 4, 5 hours when I can get even better service with MD Live. I mean, so as parents, we always deal with our children being sick and little things like pink eye, ear infections, and now I know that instead of going to sit in a waiting room, I can just call and have my daughter stay at home comfortably and deal with it that way through MD Live. The most beneficial thing about MD Live to me is the time that it saves me, because during a school year, I'm a teacher and I have 100 kids that are mine. And I have no time between my own children and the children that I deal with at school to go sit in a doctor's office. And so being able to call someone and know that they'll help me out when I need them the most is very important to me. I called, I was sick on a Saturday, I had to go into work. I had kids in a classroom waiting for me to tutor them, and I called MD Live, spoke to the doctor said, we'll get you your medicine right away, got off work, went and picked it up. It was really an easy process, and it made me feel a lot better by the time the work week actually started.